Greetings, everyone. And of course, I would like to thank the organizers and the committee, and of course, Dr. Lauren Lichtenstein for inviting me and giving me a chance to have a lecture on their fifth postgraduate course entitled New Directions in Surgical Practice. And the topic that was assigned to me is about ostomy care. Now, these are my common disclaimers wherein the contents of this slide doesn't really necessarily reflect the opinion of the institution, the committee organizers, but are for basic scientific discussions only and not recommended for off-label recommendations. Now, to give us a brief background about the Ostomy Wound Center. The Ostomy Wound Center is a multidisciplinary and multi-specialty center that takes care of people who have problems with ostomy, wounds, and incontinence. No? So we have developed and formed the center around 11 to 12 years ago, together with the collaboration of course, yours truly, Dr. Marco Abad for the wounds, and of course, Dr. Rami Rojas for the ostomy. And we just started on a small room at the lower ground near the psychiatric section. And even as of the moment, is really surprised and happy that we have come a long way and we are now a big family who takes care, of course, on this specialty. Now, the key role players of this center is, of course, the highly trained, skilled, and certified nurses who works closely with the surgeons and collaborates with other departments as well, no, and other specialties. No? Different attending physicians and different specialties. And of course, to the other healthcare team members, no, in the hospital pertaining to the care of the patient. Now, throughout the years, of course, based on our experience, we have come to develop different protocols and algorithms. We have come up with these different best practices that we are now doing. Like, for example, when it comes to prevention of hospital-acquired injuries, no, and other related skin injuries that may happen to the patient. We were able to identify which wounds would have been community acquired and which of them is a hospital acquired injury. And this is very important when it comes to giving the quality of care for our patient. And of course, to improve, no, yung nursing care that we give to our patients, especially in a critical care area. So we were able to identify their different risk levels, so low risk, medium risk, and high risk. And based on those risks, we were able to to reassess them, no, based on the need and the risk level of the patient. So when it comes to the surveillance and monitoring of these injuries, we were able to have a dedicated wound nurse assigned on different areas. So we have a dedicated wound nurse on critical care settings. For example, we have a nurse assigned at ICU who does the daily assessment and change of dressings for patients who are confined there. We also have a dedicated wound nurse, no, assigned at the nursing floors who will take care of inpatient services also. Now, when it comes to treatments and modalities, our basis is, of course, the use of the different evidence-based concepts, no? Specifically the MOIS concept, and of course the time concept. And we also do and use other adjunct therapies that are evidence-based, such as, of course, your negative pressure vacuum therapies and other modern and advanced dressings that we have now at the hospital. Now, when it comes to the nurses, of course, when it comes to the scope of practice, we base it on the scope of practice here in the Philippines, as guided by, of course, the Board of Nursing in the Philippines by the Philippine Regulations Commission. And this is to identify the real role of the nurse when it comes to taking care of patients with ostomy care. We don't want to step in and work as a doc and work into the role of the doctor. And we make sure that there's always a limit when it comes to that practice. It's always a collaboration, not a one-way situation. Now, what is unique in our institution is that we have included patient and the family when it comes to taking care of them. And we have found out that patient independence, specifically when it comes to ostomy care, is much more better compared to just involving the patient, no? Wherein we involve the patient and family, the patient's family as a part of the support group when it comes to taking care of them. And our main goal is, of course, to improve their quality of life in spite of having a stoma. And one of our main motto here is, of course, treating the whole of the patient and not just the whole of the patient, no? Wherein it involves the patient holistically. Now, basically, in involving the patient and the family, we have preoperative counseling, of course, early discharge planning, evaluation of the patient's independence prior to discharge. Uh, this comes with the patient who have ostomies, and not only with ostomies, also with wound care. So that when they go home, especially now during the pandemic, of course, the access to care is quite difficult, you know, when it comes to the lockdowns. At least the patient and the family member will know how to take care of themselves in cases of emergency. Now, all of this, no, this main concept and taking care of patients with stomas started with this lady, Miss Norma Hill. So Miss Norma Hill is not a healthcare provider. No? She's not in the field of medicine and nursing also, but she's a patient. She's an ileostomy herself. So because during their times, they were always having problem when it comes to taking care of themselves, how to take care of themselves, who are they going to talk to when it comes to their concerns after the surgery. So Norma Hill, together with her colorectal surgeon, Dr. Turnbull, have that's in Cleveland Clinic. No? They have formed a group wherein the World Council of Enterostomal Therapies trains and certify healthcare professionals who wants to be a specialist, no, when it comes to the field of wounds, ostomies, fistulas, and incontinence. No? Now, coming all of this is that they have also formed a support group, no, internationally. It is the International Ostomy Association, wherein they said that all ostomies shall receive a preoperative counseling to ensure that they are fully aware of the benefit of the operation and essential facts about living stoma. Wherein basically we do experience most of the problems when it comes to handling the patient's psychological aspect, no, on having the surgery. Wherein sometimes patients might think that the stoma will just be temporary, wherein it is already, wherein it is permanent. So it is very devastating when it comes to the patient and also to the family member, because they were thinking, am I going to get back to work? Am I going to continue living a normal life? So pre-operative counseling is very important, and also post-operative. So it must come up with a process. And proper counseling to the patient and family members is to develop patient independence when it comes to taking care of their own stoma, so that they can go out, continue their daily living, to prevent, no, and to treat future complications by themselves. These are minor complications that they can handle, wherein there's no need to go to the hospital pertaining to the treatment. And all of this, again, goes back to improving their quality of life in spite of having stomas, no? Or in spite of having colostomies and ileostomies. So in our institution, we were able to develop these three different phases in taking care of this patient who have stoma. So one is preoperative counseling, post-operative counseling, and of course, continuative care. In preoperative counseling, it involves, of course, ostomy marking or siting and planning, wherein the nurses choose the right area or the ideal site where the surgeon will exteriorize the intestine, or where the stomach is going to be placed now. So preoperative counseling, care planning, discharge planning as soon as possible. And of course, when it comes to the post-operative phase, we teach the patient when it comes to the proper pouching techniques, access to the different appliances, to the different brands that are available here in the Philippines or available in the market. Um, Complication management, we teach the patient and the family member how to manage certain minor complications that can be anticipated that may happen to the patient. And of course, continuity of care, wherein we wanted to extend the care of the patient who has ostomy, and not only ostomy, but also wound care to their homes. So the care doesn't stop at the hospital. So extended, yes, but it should be extended at the patient home. So we really appreciate this during the pandemic wherein access to care is very difficult. So we are the one who goes to the patient's house in terms of continuity of care. So this is our basic workflow here in the hospital pertaining to taking care of the patient with ostomy. So basically it starts with your schedule of the patient for stoma surgery. So 1 to 2 days prior to the surgery, patient must go to the ostomy center for preoperative counseling, for site marking and planning. And in here also, it is a must that they should bring their family member with them. So that when we give the counseling, we involve their family member. So we introduce to them the procedure, what are they going to expect, and what are we also need on their part as their cooperation for their cooperation, and to be able to have a successful journey on having this operation or having stoma. We also collaborate with IRAS, with Jamie Sanchez, when it comes to stoma surgeries. Now, without ostomy planning, without proper site marking or siting, ostomy siting, we might anticipate these complications to the patient. So there can be prolapse because of the not choosing the right ideal site for the patient. Also retraction. Common complication happens is that a frequent leakage of the appliance. And of course, patient will not be able to visualize well the stoma because of the improper site of the stoma. Now, when we give counseling, it is very effective, and the patient and the family member may appreciate it more if you have visual aids, or we call them flip charts, no? When we teach the patient and the family member, so that it may be easier for them to understand. And we bring also samples of the appliance that they're going to use so that they can see. Sometimes it's hard to visualize, or it's hard to think of something that they haven't seen before. So when you introduce something to them, make sure that you bring different appliance and samples as well. So when it comes to preoperative counseling, most of the issues that and concerns that the patient uh, might verbalize is, of course, what about the odor? What about the sound? What about the appearance? Will it show? What will my partner will say to me? Will I injure my stoma when I go to work? Can I be able to go to work? So make sure that when you give counseling to the patient who will have a stoma or have a stoma, you are well prepared, to answer these certain questions. Now, when it comes to post-operative stoma care, make sure that you will be able to teach the patient and the family member to identify which one is a good stoma and which one is a bad stoma, so that they can easily tell their doctors or their nurses if something is wrong. And also make sure that you have gained proper rapport to the patient so that they can verbalize it. They have this certain trust to you. Now, when it comes to pouching techniques, be sure to use, of course, the right appliance. There are different sizes when it comes to the ostomy bags. And to avoid, again, leakage and skin irritations, make sure that everything is available at the bedside when you are going to change the bags, or change the colostomy bags. Prepare all of the equipments, necessary equipments at the bedside before opening the old appliance, so it won't be messy. So when you take out the old bag, this is how it looks like. So we can see some irritations and redness on the peristoma site, or the site, the peri wound area, or the peristomal site. And it only indicates that the appliance or the stoma bag may have been there for a longer period of time. So a normal bag, one-piece bag, can stay to the patient for at least 2 to 3 days. A two-piece bag, this comes with a vapor and an apply with a pouch, normally stays to a patient 5 to 7 days. Anything that would last longer than 7 days can cause irritations to the patient's skin. So as much as possible, we only advise them on the certain period. Now, when you measure the size of the stoma, if there's no measuring guide, or most of the measuring guides comes with a perfect circle, and not all stomas are perfect circle. Most of them are oblique or with an irregular shape. So what we do is we use a template and trace the size of the stoma there and then put the date to identify the right size during the time of your first measurement. And then we apply ostomy powders at the side of the stoma to take care of those skin irritations. And then we also apply stomahic paste around the stoma. So to make sure that this will add additional adhesiveness to the ostomy wafers and to the ostomy bags, and also to prevent leakage. No? Now, this can be sometimes, no, if the ostomy paste have alcohol contents, no, because most of them have alcohol contents, the patient may feel a little stain. So that's why we make sure that we check all the products that we use for the patient first. No? So if the patient has skin irritation, most probably the patient might feel a little sting or little pain, but it will go away as the paste or the ostomy paste dries up. Now, it is stoma friendly, so it is safe to be in contact with your stoma. Now, make sure that when you have applied the paste properly, you apply the bag and the pouch on the tight fit and snug fit on the stoma. Now, common complications may happen, skin irritations or skin excoriations. This may be because of wrong cutting of the base plate or the flange. It can be bigger than the size of the stoma. So make sure to cut it properly. Or the stoma appliance or the wafer was attached to the skin for a longer period of time as advised, no? Or not as advised by the manufacturer. There is an allergic reaction of the patient's skin to the ostomy appliance, so it's best that you change the brand that you use to the patient. Now, another thing is that when you frequently remove these ostomy bags to your patient, of course, the skin on the peristomal area will become thinner. So it will be prone, or it can be at high risk of developing skin breakdown as well because of the frequent removal of this appliance. So as much as possible, when you apply a stoma bag or a stoma pouch, make sure that it stays there for as long as 3 days, no? Or as long as 7 days, depending on the type of appliance, but not longer than 7 days. Now, common appliance and accessories that we use here in the hospital is, of course, ostomy powders and ostomy paste, which can be very handy when it comes to managing minor complications to the patient. Some of the questions that the patient might ask also when it comes to postoperative care is that, can I continue to go to work? Can I how about my social life? How about my clothing, showering and bathing? Can I take a bath? Can I take a shower? Can I go swimming? No? So these are the most common things that we also do give education to the patient and the family. Now, when it comes to food, it is best to refer your patient to a nutritionist or dietitian for counseling. And for the basics, no, we tell the patient to at least know the effect of the food to their body. And most probably when they are concerned about bad odor, so identify foods that may cause bad odor, identify foods that may promote diarrhea, identify foods that may cause or promote constipation, identify foods that may cause gases, but not necessarily advising the patient not to eat at all, because the effluent or the discharge that comes out on the patient's stomach is involuntary. So they lose a lot of fluids and electrolytes, no, on their ostomy effluents, no, or their discharge. So they have to take in nutrients as a replacement. So we have ostomy kits available at the center where we give to the patient, to the family members, so that when they go out, they can have all of the things that they needed with them in handy. So they won't be having trouble going to the public restroom. So they have an extra bag with them, and it's already pre-cut. And we also teach them on how to prepare all those things also. So this is what I've been telling a while ago when it comes to continuative care. So we have a Wounds on Wheels program wherein our nurses go to the patient's home to take care, of course, of patients who have ostomy, problems with ostomy, not only with ostomy, but also with care. So this is a very successful program. And in a day, we have 5 to 6 patients where our nurse would go. And they have Uh, of course, real-time collaboration with their attending physician or to the surgeon assigned to the patient. So all of these instructions and the care of the patient is still under the surgeon's care or under the attending physician's care. And our nurses collaborates with them after the care or during the patient's visit. Now, all of this comes with what do a ostomy really need? What are the true needs of an ostomy? So number one, of course, is trust, confidence on their nurse and their healthcare provider to know that the nurse will take care of them, really know what to do or really know what they're going to do. You have to be competent when it comes to the skills that you're going to give to the patient. You have also to be compassionate when it comes to the care. You have to understand the patient because we know that the changing of the bags is only secondary. Mainly is the psychological effect to the patient having a stoma. They need someone to talk to. They need someone that would understand them because most of the time, even their relatives are the one who's really disgust of them or doesn't want to take care of them. So we as healthcare providers should be there for them. So when it comes to choosing the proper appliance, of course, number one is the appliance that they need to buy must have proper security, would give them privacy, skin protection, and when it comes to access to care, it is available everywhere or can be easily accessed. I think that would be all. And again, thank you very much for your invitation. And this is the team of the Medical City Food Center. Thank you very much.